and welcome to our ongoing series focusing on COVID. Testing has become a major issue. There are queues and a long wait. The latest is do not get tested. In this edition of HT's talk show, The Interview, we have with us Dr. Navin Dang, the go-to person as far as tests are concerned. Welcome to the show, Dr. Dang, and thank you for being with us and sparing the time.
Thank you, Kumbunji. Thank you very much for inviting me. It's indeed a pleasure and an honor.
Dr. Dang, you are the go-to person today. Everyone says, we want to get tested, but we want to get tested only by Dr. Dang's lab. How long are the queues and how much is the pressure?
Kumbunji, I have tried my best to see that the queues are not long, the waiting is not long, because I've tried to curtail my own limits and focus on quality and timely reports. As initially it was told by the government, and as the directive is also now, we have declared a certain capacity, and beyond that capacity, we have been advised not to go beyond that capacity. Say my capacity is say 100 tests, I take it maximum till 120. I do not go beyond that because it's very pertinent to give the reports within the stipulated time. A delayed report is as good as not giving a report. So I try my best that the report should be absolutely accurate, correct, and within maximum 24 hours, though we try and give the reports within 12 hours.
You know, when you say 12 to 24 hours, on the ground that does not seem to be happening because reports are taking 3 to 4 days.
Kumkum, in the last 1 year, I do not think there has been a single report which has gone from my lab later than 24 hours. Yes, what you're saying is absolutely correct. Ground reality is different in the way that there are lots of labs which are taking longer to give. And the reasons for that, again, are quite a few. See, in this era, when COVID is at its peak, which was quite expected, government is burdened with samples. Government sector and private sector are moving hand in hand together to fight this pandemic. So lots of us, lots of my other colleagues are burdened with samples which are much more than what they can handle within 24 hours. And one more thing, it's not only the testing what is there. The time that goes is in collection of samples, and more important, the time which goes, which I would like to emphasize, is on the data entry and the result uploading. This has been a very major lacuna. This has been a very major stumbling block in giving the reports early and in time.
As I am able to understand from what you're saying, it is the government who's putting restrictions of how many people you can test. And even if you can test more, or even if you want to test more, you're not able to. Is that what you're saying?
No. Government says increase capacity and do as much as you can. We would love to increase the capacity and do as much as we can. But for increasing the capacity, there are lots of other factors which come into play. We require more equipment, we require more manpower, we require more space. Government's directive is that the results should be uploaded and told to the government within 24 hours. Otherwise, we are liable to be delivered a notice. And most of us want to stay right side. So we are taking as many samples as we can. This 24-hour cap is something which, of course, none of us want to breach. And once breached, then a notice is served to us. So that's something which has been a limitation that we cannot do samples more than what we can deliver in 24 hours.
So, if the government stipulation of this 24 hours is removed, do you think more tests can be done?
Yes, that can be done. Once they say that we can take we can take samples and can be delivered from 24 to 36 hours becomes more realistic. 24 hours is something which usually lots of labs. I'm not talking on my behalf. I'm not talking only on behalf of Dr. Dang. You mentioned the word ground reality. That covers all the labs who have got limited resources. They're unable to deliver within 24 hours. Shifting from 24 to 36 hours can be one of the major steps that the government can help us in increasing our capacity.
So, have you and some of the other labs or any association which you have you recommended this to the government that instead of 24 hours to give you 36 or 48 hours to ease the burden?
Yes, please. We have done that.
And what has been the government's response?
We still await a response since last quite few months, please.
Yeah, but waiting is not a very good idea in these days, because by the time the government responds, the crisis would perhaps, fortunately, be over. So, as a person who heads a very prominent lab, what are you and some of the others doing to push this?
Ma'am, except for giving a representation and requesting, there's nothing much more than we can do. We explained our own limitations. We have told the government authorities. I said I can always say the government authorities have always been very receptive to what we have said. But for this aspect, still we have got no answer from them. We await a positive.
Dr. Dang, if I may say so, in these times of crisis, don't you think you people are somewhere shifting focus and also shifting responsibility and putting it at the doorstep of the government rather than leading from the front?
It's the other way around. I think from the time the pandemic started, we have never shirked our responsibility. Government hospitals and private sector has worked together very well, hand in hand. Rather, every day, whatever has been the request of the government, we have fulfilled it to the last day. We have tried our best to expand and increase our capacity. But of course, limitations have been there, and as a result of which, we have not been able to expand as much as even we would have liked to. In the second wave, ma'am, the biggest hurdle that we faced and are facing right now is man. Nearly all the labs, nearly all the medical establishments are facing this problem of a large number of healthcare workers who are suffering from COVID themselves or their family members. They can't pull them out. Number two, the reluctance of now lots and lots of frontline healthcare workers who do not want to work in healthcare establishments. A simple thing like a healthcare insurance also for frontline healthcare workers has been withdrawn from the government, from the private sector. Through this media, through this show, Kumkuji, I humbly request the government to keep the interests of the frontline healthcare workers in mind and reinstate the insurance which has been withdrawn. So we are facing a huge crunch of manpower.
Okay, Dr. Dang, let me come to another point, which is when to get tested, how to get tested, and why to get tested.
I take the liberty of saying out here with all humility that most of us do not know. The first time even we heard the name, the novel coronavirus, was in February, March last year, 2020. Over that 1 year, we have learned. We learned from reading. We have learned from each other. We have learned from experience. First thing is, your question was that when to get tested. Ma'am, the right time to get tested, the incubation period, as we know, the virus is 2 to 15 days, with a median of 5.8 days. The right time to get tested is about the 6th to 7th day. Unfortunately, people rush to get themselves tested just a day after a high risk contact or 2 days after that. And they come out and they test negative, and then they are in a state of complacency in this that we are tested negative. No, ma'am. I would humbly request all people who come in contact with a positive patient or are at high risk to not to get themselves tested before 6 to 7 days, unless and until mind you, there's a right to it, they develop symptoms before that. Which test to get done? The gold standard till now remains the RT-PCR. There are other tests in the market also, like the rapid antigen test, which again serves its own purpose. Ma'am, all tests serve their own purpose. The rapid antigen test is a very fast, available in all hospitals, is extremely inexpensive, and if tested positive, you're 100% positive. If tested negative, and still there are symptoms of influenza like illness, then the patient is recommended to go and get a PCR test.
False negatives and false positives in even RT-PCR tests. So just take me through that.
Okay, ma'am, every methodology, every test has got its own limitations. The RT-PCR test, real-time PCR as we call it, has got a sensitivity of 70%. That means that it can pick up only about 70. That is what I mean is the sensitivity when a patient comes to you into the test, patient may actually be having disease, but we are only able to pick up in 70. So when you say that the report is wrong, I would strongly beg to differ with it. The report is not wrong. It is the methodology as such, which is not an ideal methodology to give us a foolproof result of a positive result, even the patient may be positive. Here, I would like to describe to you what I call the long wagging tail of the RNA. That is, even when the patient is cured, the patient no more transmitting the virus, the patient is no more suffering from the disease, but still the dead RNA particle viruses, they persist. And when we do the test, that test shows it to be positive. So again, that is again a lacuna or I can say a problem with this particular technology. The test is not wrong, but these are problems of the technology. And this is the time where I will say again that most important thing is a consultation with doctor. Let the doctor decide whether you actually require another test or not, whether it's a false positive or it's a negative. Like if I have a patient who has got typical symptoms of COVID, say loss of taste and smell, etc., which I won't go into the details. I'll just say that even the test is not negative, I would recommend the patient to be treated as COVID positive.
You said RT-PC tests have a 70% efficacy. Uh, are there any new tests coming up? And is there any research which would give us foolproof tests in the near future?
Ma'am, at the moment, there are lots of tests which are in the anvil. We've got a couple of new tests, but the sensitivity and specificity still remain the same. Every day, I'm on the board of various different international foundations uh, and organizations where work is going on to improve the sensitivity and specificity. But at this time, it will be injudicious for me to say that we have reached for something, we reached a test or got a test which is 100%. No, at the moment, no.
So, what you're saying is that what we are doing in India is a gold standard.
Yes, ma'am. In India, what we are doing as far as the testing methodology is concerned is very, very good. My compliment to the Indian companies who will land it up with very good. My compliment to the government and ICMR who has been on a very fast forward to approve the tests, and those tests are being made available. And all of us are now at no shortage of testing kits. I'm talking about testing kits for testing RT-PCR, which are available and which are very cost effective, and which we are offering to the patients and which can be done fast and with ease.
Dr. Dang, you're complimenting the government, which seems to be a stumbling block as far as tests are concerned.
No, ma'am. Again, when I said, please underline my word, I said compliment to the government for having approved the tests. Please understand that as soon as a new test is introduced in the market, ICMR is taking pretty quick in approving the test. I'll give credit where it is due, and I'll not give any credit where it is not due. There are many problems which have been created by the authorities, which I'll not give them credit for, but for whatever they deserve the credit for, I think they should give it.
That's a fair point. One view is don't get tested, don't waste your time. If you have symptoms, just take medication.
If a patient has got influenza-like illness, if a patient got typical symptoms of sore throat, of cough, of cold, of fever, muscle pains, body ache, loss of taste and smell, etc., which are typical features of COVID, why waste time and money getting yourself tested? When there's a pandemic going on and we are seeing that the percentage of positivity is so high, why not start the treatment immediately? Why not start monitoring yourself immediately? Why not put yourself under the care of a doctor immediately? So I would recommend do the test whenever you feel it is necessary. We are always there to look after you. But where not required, please don't. Immediately consult your doctor.
But a patient may not have all these symptoms. They may have one or two symptoms and it may not be COVID. Is it then sensible to go on COVID medication, which obviously stresses your system, without a test?
Of course not. I said if you have all typical COVID symptoms, If you've got just one or two symptoms, like I know people who have landed up with positive tests only the simple thing as low grade fever. I know people who have landed up positive with only muscle aches. I've landed up positive patients with having just one or two of the symptoms. I said what that if you have all the symptoms which are typical, like why I'm emphasizing that this is the third time I mentioned loss of taste and smell. There's no other condition where I know of where there is loss of taste and smell. So if you have loss of taste and smell, why wait first to go and get it test done? But yes, on the other hand, if you're having fever, if you're having body ache, if you're having headache, then of course go and get a test done.
Dr. Dang, what about asymptomatic patients?
Now that is something which has foxed all of us. Thank you, Kunkunji, for asking this question. This has been the major cause of the spread of yes, asymptomatic patients problem, and that is something for which none of us have any answer for. No. If the patient is asymptomatic but has been in contact with a positive patient and 6 to 7 days have elapsed, then please get yourself tested. But if you have not had any history of any contact and you have been absolutely in a bubble and you're asymptomatic and you want to get yourself tested just for the sake of getting tested, then don't. There are lots of people who are getting it tested just for the sake of they do not overburden the system unnecessarily.
Dr. Dang, I understand the pressures on you. I understand the government regulation. But I will still ask that there is this lot of this stress on apps and online, contact the lab online. But I'm sure you're aware that there are a lot of senior citizens who do not and are not tech savvy. Don't you think a human help desk in labs should be available for them?
Absolutely. I fully agree with you. Like what I say, like I was told this 30 years back, but with no less than a film star, Nargis. The most important thing is to look after the senior citizens. And the most important thing that matters to us, the blessings of elders. To look after senior citizens is our duty. Yes, and we all do our best to do that. Somebody has to contact us. Somebody has to tell us that this particular senior citizen is not being able to reach out to us. And I'm quite sure all of us, purely on humanitarian grounds, will leave 10 other things and look after them.
Dr. Dang, I appreciate and respect that sentiment. But on the ground, when one calls, and I don't mean this only for your lab, I'm saying for most labs, when one calls, there is a voicemail and there is no human contact. How does one, so when you're saying a senior citizen should contact us, how do they go about it? And that is why I asked about a human help desk.
Kunkunji, all of you know that as far as I'm concerned and my lab is concerned, human touch has always been the most important. But in this era, where nearly 50% of the manpower is down with COVID themselves, when people are not willing to work in healthcare establishments, when we have to outsource even our phone calls to call centers, I agree to it that this is something which needs improvement. I'm open to any kind of suggestions that what should be done.
You know, most labs are now on voicemail, including yours. And what they say is, we are full up, there is a long queue, please wait for a few days. How can you do that, Dr. Dang? How can you down your shutters when the patients need you the most?
At this time, there is no solution because when nearly 50% of manpower is down and healthcare establishments with COVID themselves, we have no option but to put in voicemail.
Yeah, that's the whole point. You know what people are saying, that at a time of crisis, if our lab or our doctor is not available, then what's the point? Where are we? It's like the
I,
government which has left us to be on our own and to die on our own. So that is the complaint which people have vis-a-vis testing also.
we are not letting anybody die on their own. We are doing the best that we can to see that we all live together and live healthily together. But your point is pertinent that they're not able to contact us. Yes, lots of people are not able to contact us. But from our point of view, when the situation is so bad that there's nobody to pick up the phone calls. What to do? It's a question of helplessness that we are all facing.
Dr. Dang, what does the road ahead look in terms of testing? How much is the stress? Have the queues shortened? Has the wait become less? What is the situation and what is the road ahead, as I said?
Totally unpredictable. We did not expect after the first wave that the second wave will hit us so hard. We had been warned that the second wave, but the government was not prepared for it. Even we were not prepared for it. We did not expect the second wave to be so ferocious. We should not be complacent. We should, like what I said, keep on increasing our testing capacity. I'm only limiting myself to saying testing capacity. We should have more and more training for molecular biologists. We should have more and more training for phlebotomists. The key word to everything what I'm saying is training, training, and motivation to see that we're all motivated to see that we are all holding hands together in fighting this pandemic. Like I said 1 year back to you, Kumkumji, is a war. It was something like a 1971 Indo-Pak war. That time we had an enemy which we could see. Here we have a hidden enemy who we cannot see. We do not know from where we are being attacked. We cannot let guards down, at least for the next couple of years, I'll say. For the next couple of years, we may expect a third wave, we may expect a fourth wave, but we have to be fully prepared with all our armory and artillery intact to see that we're able to fight.
Coming to these new strains, would you say that there are any additional tests required?
Well, as of now, genomic sequence is important. But that's nothing which is very simple and that cannot be done in any other routine labs. Because all the routine tests what we are doing, that is a routine RT-PCR which we are doing, is able to pick up all the variants. It's a myth going on that we are missing out the variant strains, the variants of concern as they're called. No, we are picking up all and we're taking out a significant number of those samples and are giving to government hospitals and government labs for genomic sequencing. But as far as the test is concerned, I do not think we have reached a stage where we are missing out anything.
Even the new strains?
Yes, ma'am. Even the new strain, I do not think as of now. Even yesterday, I had a long discussion with few of the senior scientific leaders in the country. We do not think we are missing out any of the new strains.
That's
With
encouraging to know because there are lots of theories and stories going around, and there is a lot of panic on that front. So another theory is after 7 or 8 days, the virus in the body is dead. So the tests then become cosmetic, if I may use the term. Is that correct?
I'm not the seventh or the eighth day. Uh, I'll say that after the 10th day, if the patient is symptomatic, I do not think this is recommended. As per the new guideline issued to us by ICMR on 4th May, that just about 3-4 days back. After the 10th day, I'll again underline the word. If the patient is asymptomatic, the patient can come out and lead a normal life without in any way being hampered by the fact or having a doubt in their mind that they're still carrying the virus or they're transmitting. So the not cosmetic is actually a reality that after 10th day, which initially was recommended as 14th day by WHO, WHO says 14 days. ICMR is now in last 4 days saying after the 10th day, we do not require a retest at all.
Do you think that is right? Because somewhere a test to show that you are negative is necessary. And if you are giving a go by to that, are you just doing it to reduce the stress on the labs?
Personally, I agree with you. I agree with you. I feel that a patient should at least for 2 weeks, minimum 2 weeks, assume the patient to be positive, and after that can be presumed to be negative. But having a negative before the patient comes in and start leading a normal life in the workplace, I think is important. This is my personal view, though everybody is saying that after 2 weeks you do not need to get self-tested. The two ways this I agree is will decrease the burden on the labs. I agree, but I am not very sure whether this is the right step forward.
I agree with you fully, Dr. Dang, on this. How effective is the Arogya Setu?
Again, a nice
I
question.
use it very often. I use it very often for my mental peace. So, how effective is
That's
the
what I'm going to
Arogya
say,
Setu?
very pertinent. Aragya Setu has got very different elements attached. And one of those, as again being a part of diagnostics, I won't go into other things like vaccination, treatment, etc., reliability of hospitals, etc. I'll just restrict myself to diagnostics only and say that it is good, but it creates sometimes quite an unnecessary. I got a phone call just a few minutes back that my Arugya Setu app has turned color, and I've not been in touch with anybody. I'm inside my own car. Only assumption I can have is maybe the person sitting in the car next to me was positive and my Arugya Setu app has turned color. I have no answer for such questions. The thing is that yes, one way we can say it creates fear. Number two, we can say that it tells us to be cautious. So both fear and caution are two things which we have to handle and balance uh, with our strength of mind and with our own thought process.
While choosing a lab, Dr. Dang, what are the do's and don'ts?
Kumkumji, at the moment, though, we are in a state that we have no
Any
option.
lab is good enough.
Any lab is good enough. So any lab which is approved by the ICMR and who has the credentials to be running for RT-PCR lab is good enough. We've got very few choices when the labs are overburdened, and like in this conversation, you devoted a significant amount of time in saying that inability to reach out to the labs and say whichever lab is approved by ICMR is good enough, and we should take your test from any of these labs.
What are the follow up tests required after a patient has recovered from COVID?
If the patient is recovered from COVID and is having no symptom, is totally asymptomatic and leading a normal life, I personally do not think there's any follow-up test. No test
Okay.
required if the patient, I underline the word if, is fully recovered and the clinician has given you a clean check.
There is this other thing about higher the C count, the lower the infection. Does this have any basis? And would you explain this to me?
For this question about the CT value, which you're talking about cycle threshold value, I think that's what you meant. I think let's leave it to the wisdom of the doctor who's treating you. We are treating the patient and the symptoms. We are not treating the CT value. Of course, a CT value of more than 30, we can say the patient is non-infective. The patient can lead a normal life. But below that, CT value of 14, 15, 25, 26, 28, please let the doctor decide what kind of a life you should have, what kind of treatment you require. The treatment protocols are not dependent on the CT values. Remember, Kumkumji, it's a qualitative test, RT-PCR. We have tried to convert it to a quantitative test by laying so much of emphasis on CT value. CT value has got its own importance, yes, but that is not the sole criteria on which the patient's management is based upon.
What is the role of antibodies testing? Are they necessary?
Kumkumji, we in India are kind of, I can say, obsessed with getting antibody tested for every person who has tested positive for COVID or has had a vaccination. Antibody tests are important, no doubt about it, but at the moment their role is not very, I'll not say not important, I'll say role not very clear. It does not mean that the higher the antibodies, the greater the bank balance of protection which you have in your bank or in your body, no, like that. Equally important is something called a cell-mediated immunity. People with low level of antibodies also can be as well protected as the patient with a very high level of antibodies. Here I would like to emphasize to this conversation that please, whatever your level of antibodies are, do not go into a sense of complacency. Do not go into a mode of saying that I become all right, मैं ठीक हो गया हूँ, I throw away my mask, I do not follow the COVID norms, I start leading a life. No, please. We are seeing a significant number of patients have high level of antibodies who are still having an infection. On the other hand, we are having patients We have no, I won't call them patients. I have a large number of colleagues with practically very low antibodies who are absolutely fully protected. So the role of antibodies is just for our own mental satisfaction more than anything else. No role of antibodies as far as I'm concerned in saying that once I have antibodies, I am fully protected. No, there's nothing like that. Rather, if you go back to US and after the Pfizer Moderna vaccine, so there's hardly anybody who's getting the antibody levels tested abroad. And even if they get themselves tested for antibodies, the answer which they're given is antibodies present or absent. I don't think anybody in the US is getting a value of the antibodies which they're getting. And if you have to get the antibodies done, here I would like to emphasize to the viewers, please get anti-spike antibodies IgG done. IgG anti-spike antibodies quantitative, that which gives an exact value. That is more important than just getting any antibodies done.
So, after vaccination, is it advisable or is it a must or a complete no no about getting antibodies tested?
There's nothing called a complete no-no, but it is not a must at all. And even if you have to get your antibody test done, do not get it done for 2 weeks. And whatever the levels of antibodies are, just have a look at it, smile, fold the paper, and keep it in Almira. There's nothing like saying, okay, if I've got antibodies of 600 or I have antibodies of 60, 600 is more protected than 60. There's nothing like that. It's just for your own mental satisfaction that yes, I do not have the disease. I've got a vaccine. It has produced an antibody response in my body, and that is what is good. That's it. Nothing more than that.
So, a person who's not had COVID has had 2 doses of vaccination and goes for an antibodies test and finds that the antibodies have not developed. What does that signify?
But it signifies that he's got no antibodies. That's all. Nothing more than that. He may be
But he's
having a very,
protected.
I'll give you an example here. Every year we get flu shots put. Children get a diphtheria, pertussis, tetanus vaccines, etc. put. They get polio vaccine taken. How often have we looked for antibodies against them? I think never.
Never. It's only come
Never.
up now.
It has come up now. So that is why I'm discouraging. I'm just saying that the recommended protocol is 2 vaccine shots for Covaxin after 4 weeks, for Covishield 8 weeks, now being recommended even to go up to 12 weeks. And after that, getting an antibody test is not at all mandatory. You may or may not develop antibodies. Even if you do not develop antibodies, assume that you have developed a certain level of protection. What level of protection? That depends upon the efficacy of the vaccine. And none of us sitting out here can answer how much is the protection that you have got.
So, which means that even if antibodies are not developed when you get it tested, it doesn't matter if you're vaccinated and there is a certain level of protection which is there. Is that
Yes,
what
ma'am.
you're saying?
Absolutely, absolutely. That is what is being said. That most of us, here I say most, I won't say all, most of us who have had 2 doses of vaccines and 15 days after the second vaccine have developed certain level of protection which prevents us from getting the disease. We may get infected. Ma'am, here I would like to emphasize the word infected and disease. We may get the infection, but will not get a severe disease. You may get a mild infection, you may get fever, you may get sore throat, you may get body ache, you may get muscle aches, but usually we will not land up in the hospital. And that is what the main purpose of the vaccine is, and that's something which should give us a major amount of solace.
That's reassuring to know, Dr. Dang. Now, finally, my last question. What do you think the government should have done but failed to do?
I think in the end you land up with the most difficult question. We'll call it a bouncer. Well, it is very easy to say that Virat Kohli should have gone on the back foot and not gone the front foot, and that's why he was out. So it's very easy for us to sit in a studio or a drawing room and start criticizing and giving our own comments. Well, first and foremost was that we should have been absolutely prepared for the second wave, which we were not at all. For the first wave was coming, when first time I remember doing the test for the Italian tourists who were out here, who were admitted in Medan. We looked after them so well. Government was very swift in taking action that time, in involving the private sector, involving the private hospital, the private labs. Everything moved forward at a very fast pace. But then came a stage after we found that the cases had started. We declared ourselves to be COVID free. We declared victory when it should not have. That was the biggest mistake which we did. We dismantled a very well established organization which was fighting the COVID first wave so well. Dismantled completely. We went into a complacency. I think that was the biggest mistake that we did. We kept the motivation to a lower level. We did not prepare our medical college students, nor our nurses. Mind you, here again, I'll repeat from Dr. Devi Shetty's video, which I saw recently. The most important link in curing a patient are the nurses. At the moment, also, it is said that all those nurses and doctors who are preparing to take the exams should be brought to the front line. And please, ma'am, remember that the dignity of a doctor and nurse has to be kept in place. I'm going to do something which lots of people may not like. Can you imagine? A certain state has issued a notice that they're going to pay a princely amount of 3,000 to a doctor per month to be on COVID duty. I think something to feel so ashamed of. If we do not have a motivated manpower, we are going to lose the battle. We can get equipment, we can get space, we can get finance, but we cannot get a good motivated manpower. And that is what the government should work for and keep on strengthening the infrastructure.
On that note, Dr. Dang, let me thank you very much. Thank you for being here and thank you for answering all the questions.
Thank you, Kunkuchi, for calling me. It's always a privilege to be with you. I am delighted that I was able to contribute to your decision. Thank you very much.